Hey everyone, I'm Dr. Jacobson, your go-to board-certified plastic surgeon right here in sunny Beverly Hills. Buckle up because in my practice, I've seen it all. From jaw-dropping transformations to some truly unforgettable procedures. It's been quite the journey and I can't wait to share it with you. Join me on the Beauty Blueprint, where we'll dive into cutting-edge procedures and techniques in the world of cosmetic plastic surgery and explore everything you need to know about the overall health and wellness. But that's not all. I've lined up some exciting guests who will share their insights on various aspects of health and beauty, making every single episode packed with valuable information and fun discussions. So grab your coffee and get ready to join the conversation every Sunday morning at 7:30 a.m. right here on Go Country 105. You won't want to miss a moment. Good morning, Go Country listeners. We're happy to have you back with us this week. If you are a new listener to the Beauty Blueprint, welcome to the show. We air right here on Go Country every Sunday morning at 7:30 a.m. I'm your host, Dr. Joshua Jacobson, your beauty architect. And I'm here with my co-host, Ashley, who's also my patient care coordinator. Everyone, welcome Ashley.
Good morning, everyone. We have such a great show planned for you today. I'm super excited. We're going to be talking about body dysmorphia and plastic surgery. To help us with our discussion today, we have with us Dr. Judy Rosenberg. Welcome, Dr. Rosenberg.
Thank you so much for having me on here.
I'm thrilled to have you here. I know, Dr. Jacobson, you have some great insight on this topic that you cannot wait to share with our listeners, but we're also looking forward to hearing from Dr. Rosenberg.
That's right, Ashley. I could really go on and on about this topic, and Dr. Rosenberg, you're no stranger to being on the radio, are you?
Not at all.
Yes, you also have your own YouTube channel. How do we watch that?
Yes, thank you for mentioning that. It is a YouTube channel titled Dr. Judy WTF. What the Freud, and the theme of it is why we repeat things, then we don't get closure. And it is a play obviously on Freud, who has the concept of the repetition principle, which I'll get into regarding body dysmorphic disorder.
Thank you. So just to start off, could you tell us a little bit about yourself and your practice?
Yeah, sure. So I am a licensed clinical psychologist. I've been in practice since 1996. And my specialty is healing from narcissistic abuse. And for those of you who want to learn more about it, I even have a book titled Healing Human Disconnect, Be the Cause, because we don't want to be at the effect of our mental health. We want to be the cause of better mental health.
Good. Great. Well, thank you for coming to our show. So let's talk about some of the questions that we have and a lot of our listeners might have. So first, could you tell us what is body dysmorphic disorder? Because I know a lot of people, when they think about plastic surgery, they think, well, pretty much everyone who comes into our office has body dysmorphic disorder, which is obviously not the case. And to be honest, before I got into plastic surgery, or I became interested in plastic surgery, that was the image I had. So that's why I kind of was wary of it and I didn't want to go into it. And then later on, when I found out there's a lot more that goes into it, then I started rethinking it. So could you tell us what's body dysmorphic disorder?
Okay, so very simply put, it's a distortion of perception of the self that usually comes from the cause, which is the way our parents see us, exacerbated by the way society projects the image of beauty. So we have a projection of ourselves that's not even based on how we see ourselves in the mirror. If you think of looking in a mirror, think of looking in a cracked mirror.
Oh,
and then we crack up.
Oh,
and then we
that's a good
start
analogy.
picking on ourselves. So if mommy dearest or daddy dearest or somebody significant says, oh, little Johnny, you have a big nose, and Susie, your ears are really big, and Mary, your butt is really distorted looking, and by the way, I can go on and on with this, then that gets stuck in somebody's head, and then they look at themselves in the mirror through that cracked lens of perception.
Wow, and especially because they're a child and they're forming their self-image and perception, and I think that really then stays with them for the rest of their lives.
For the rest of their life until we dismantle their negative core belief, which is what I do. I take the psychological concept of the negative core belief, which is formed from early on. I'm not good enough, I'm not pretty, I'm too fat, I'm too stupid, I'm not lovable. And this becomes the blueprint of that child who is now an adult, and now that child and adult is stuck with that. So they think that by becoming prettier or enhancing this or that or having a better car or more jewelry, they're going to undo the negative core belief, and it doesn't happen that way.
Right. And so what happens if, let's say, someone comes in with that kind of perception and a plastic surgeon does surgery on them? How do they feel afterwards?
Well, first of all, I'm really impressed that you would even bother to ask that question, because most plastic surgeons just want to take your money.
That's not me.
Okay, I know that. Okay, so it's really important that you assess your patients. And this is, by the way, if you ever run into a problem where you're not sure, you're more than welcome to call me.
Thank you. We'll do that, definitely.
Because it becomes problematic. And the problem is not just with the patient. The problem can then be projected on you.
Yes.
Because the problem is that you fix their nose, you fix their cheeks, you fix their butt, you fix their skin. And guess what? They look in the mirror and they don't see it. Simply put, what do you mean you fixed my nose? Yeah, I see what you mean, but it's still too big. So in other words, the core belief that it's never good enough pops out again. And who do they blame?
Me.
Right. And who gets the lawsuit?
Me.
There we go. Okay, so I'm serious. Give me a call if you run into that.
We'll do, definitely. And in one of our previous shows, we talked about how I sometimes turn away patients who I think have unreasonable expectations.
You're right to do that.
Yeah, now I have a lifeline where I can call and get advice.
Just call and we'll do some prevention.
Yes, thank you. To our listeners, if you also want to know whether you are a good candidate for plastic surgery or not, you can call us at 424-465-3800. That's 424-465-3800. You'll talk to Ashley. She'll talk to you, and we'll go through what your concerns are and whether you're a good candidate or not.
Ever wish you could redesign your look even just a little? Meet board-certified plastic surgeon Dr. Joshua Jacobson, the architect of beauty. His expertise transforms your vision into reality. Whether you're dreaming of a subtle enhancement or a dramatic change, Dr. Joshua Jacobson can meticulously blueprint your ideal self. Don't wait, contact us today at 424-465-3800. That's 424-465-3800.
So now, how prevalent is body dysmorphic disorder in general population?
I think it's getting more and more prevalent.
And what do you think is contributing to that?
Social media.
Absolutely.
Big time. The definition of beauty. Lack of parenting. Horrible parenting.
I can see all of that.
Human disconnect.
Yes.
Because the real beauty is when we connect with people, and if we can't do that, then we're looking for, I would say, inauthentic ways of connecting.
Yes, that's very true. And a few months ago, the Surgeon General announced loneliness as being an epidemic, and they say it increases your chance of death by the same amount as smoking. So it's as unhealthy as smoking.
Yes, as a matter of fact, coincidentally, I'm having a lot of coincidences today. I'm doing my episode today at 4 p.m. on Dr. Judy WTF on the difference between being alone and loneliness. So there you have it. It's on 4 p.m. Pacific Standard Time.
Great. We'll make sure to tune in.
Thank you.
Are you ready to achieve the body you've always dreamed of? Look no further than board-certified plastic surgeon Dr. Joshua Jacobson. Dr. Joshua Jacobson offers a range of surgical procedures to help you look and feel your best. From breast augmentation to tummy tucks, our skilled team will work with you to create a personalized treatment plan designed to meet your individual needs and goals. Let us help you achieve the confidence and beauty you deserve. Don't wait. Contact us today at 424-465-3800. That's 424-465-3800.
So how do you handle patients with a history of body dysmorphic disorder? Could you just give us a little synopsis of what you do for them?
Sure. So I work with the mind map, something that I created, and I get down to it, right deep down into childhood wounds, which are, I'll list them for you: verbal abuse, physical abuse, sexual abuse, neglect, smothering, emotional neglect, And then, of course, there's narcissism, which is a specialty of mine. And narcissism is where the parents put themselves before the child. So I look at those wounds, and then I look at how this is going to affect self-image. So, for example, if a parent is narcissistic and doesn't give the child eye contact and mirroring and good enough parenting, then the child doesn't really form a good enough image of themselves. So they're always searching outside for validation. They don't have that core belief of I'm lovable, I'm good enough, I'm beautiful.
And I'm guessing they base their value and worth on how many likes they get on social media, which is very arbitrary.
Correct. The dopamine that should have gone to them, which is the breastfeeding, the eye contact, the parenting, didn't go to them. So now they're getting dopamine hits with the clicks.
Yes, and unfortunately, a lot of times they come in with a filtered picture of themselves from social media, and they say, well, I want to look like this, but obviously that's not possible because that's a filter.
Correct. And you've seen people who go into depth of morphing themselves. Do you see how many tattoos some people imprint on their bodies? Do you see how many plastic surgeries they engage in to distort, because there's no end in sight.
Yes.
It never fixes the problem.
Yes.
And that's body dysmorphia. There's no external fix.
So Dr. Judy, how does society play a role in the beauty standards, and how does it contribute to body dysmorphic thoughts before surgery?
I think that when we open up our social media and we get an impression that the people who are the top beauty contestants on the planet are getting so many likes and so much attention, we conclude that that's what we have to do to be lovable.
Yes, I agree with that. I agree. What ethical considerations does surgeons face when operating on patients with suspected body dysmorphia?
I know that this is out of the scope of a plastic surgeon's area, but I think a plastic surgeon would be well advised to get a good sense of that person's view of themselves and where it comes from. And if it comes from these negative core beliefs, then they need to understand that no matter what they do, it's not going to fix the cracked lens of perception.
Right. What impact can surgery have on the symptoms of somebody with body dysmorphia?
I think that it's like it's an up and down sine cosine. First, very hopeful. Oh my God, I'm going to come out of this and my life is going to be beautiful and I'm going to have many girlfriends and boyfriends and I'm going to be popular and all of that. And then there's, of course, the pain and the depression and then the expectation that is not necessarily met. So I think the cosine curve starts to dip, that up and down emotional roller coaster starts to go down. And then with healing, usually people with body dysmorphic disorder are disappointed in the results. No matter what, there's always, well, you could have pinched it in a little tighter, you could have pulled it up a little higher, my boobs could have been a little bit more firm, how come you didn't put the belly button? I mean, they may be micro little things, but they will notice them. And you as a surgeon might look at the patient and think, what are you talking about? Your belly button is exactly where it's supposed to be. What are you talking about? Your nose is very proportional, but they will not see it.
That's right. Do you have questions you would like answered on the Beauty Blueprint? Call us at 800-734-0040. That's 800-734-0040 and leave a message with your comment or question and we will answer it on air. Then tune in every Sunday morning at 7:30 to the Beauty Blueprint right here on Go Country 105.
Well, so now I love the fact that you talked about how this stems from childhood trauma.
Yes.
Now, the reason why I got my first breast augmentation was because my father went to my mother and said, you need to tell your daughter that she needs to go get her boobs done or she'll never make it anywhere in life.
There we go.
And so there you go. So I've been holding this one and
Thank you for sharing that.
Well,
okay.
And I wasn't your plastic surgeon, right? I only met you 3 months ago.
Yes. No, Dr. J did not has not done any of my breast augments. But so my mother took me. I had it done. I recovered on my parents' couch, and that was the reason why I had my first one done. And since then, I've had 2 more after that because I've been searching for something better ever since, in one way or another, right?
So what you've really been searching for, if I'm to shrink it for you?
Yeah, so I love where we're going with this. I get a free therapy session. I'm down.
Okay, so here's your free therapy session.
you.
Okay.
Dr. Judy.
Okay, so first of all, I'm really sorry that you took that in to mean that you're not beautiful enough. Okay, and what you were really needing is the unconditional love and approval of your father. The real
definitely
deal.
never got that.
I'm so shocked to hear that. Okay, so what you decided to do was clever. Like, okay, how can I win my father over? How can he love me? What can I do? Because the little children are starving for the love and approval of their parents. So you figured out that if you got the boobs that he wants you to have, then it'll change your relationship. So question, did it?
Oh, absolutely not. It only
I'm shocked to hear that too.
When I put on a little weight, that was what is the first thing would come out of his mouth was, "Oh, you have some thick thighs," and now I'm on an ever constant quest to lose as much weight as possible all the time. Where I've actually made myself almost sick at this point, down to 80 pounds, because I can't be thin enough. And that now that it's probably due to the fact that, God forbid, when I did put on weight, my dad always had a comment about it back when I was a child.
Okay, so this has to be dismantled. I'm serious.
We're gonna call after the show. I'm gonna call you.
Okay, you call me because we've got to dismantle it. It's not your fault. Your parents mismanaged their parenthood. I don't know what your mother was doing, but I don't know why she didn't intercept and say, "My dear husband," or "My not so dear husband, back off. Just back off. This is dead wrong."
I think a lot of people in society, especially being of our age group, you have social media has been so terrorizing on all of us girls because we're all now trying to compete to look with each other.
Right.
And no one really looks like that in real life because we're all editing ourselves.
No.
So it's really taking a toll on me where I've had to delete my social media accounts or take breaks from it because I start seeing myself go on a dark path of feeling really low, bad about myself.
Yep.
I start seeing the messages in my inbox, with bullies and what they say to me.
Yeah.
And I have to get off of it because I do have body dysmorphia where to the point where I'm like, okay, well maybe if I lose more weight, people will like me more. I will get more likes. Maybe if my hair's bigger, if my boobs are bigger, if my waist is thinner, and honestly, at the end of the day, it's just body dysmorphia. I don't, no matter how thin I get, I still don't feel like it's ever enough until I'm almost on the ground and I can't walk anymore.
Okay, so I'll put a little, another layer to this, which is object relations. It's a heavy concept. People like Otto Kernberg and Melanie Klein and Heinz Kohut talked about internalizing the parent. So when does that happen? In the first 2-3 years of life. How does that happen? Mom and dad mirror, attune, eye contact, skin contact, breastfeeding. Okay, all of that relationship creates neuro wiring of connection within the child. So what happens if we don't get that is we develop what I refer to as a hole in the soul.
Okay, I like that.
Okay?
I really like that.
Right? So now we've got this emptiness, this feeling, so we don't have that internalized, good enough sense of mom's in there, dad's in there, we're rooted in ourselves, we have a good foundation. So now what do we have to do? Drugs, sex, rock and roll, plastic surgery, better, bigger cars, jewelry, houses, I don't know. Just keeps growing.
And I gotta say, I think our patients are very, very lucky to have Ashley, who has some insight into this and has some personal experience because, like we mentioned, it never serves the patients well if they actually have body dysmorphia and we operate on them. So Ashley can actually talk to them and relate to them, and if that's the issue, she can tell them, well, that's probably not a good idea. Obviously, I work with Ashley to help determine that as well, but I think it's really lucky. And if you have questions about this topic, or if you want to know whether you're a good candidate or you're suffering from this, just either call Dr. Judy or call our office. Ashley, what number should they call?
You're going to call 424-465-3800. Once again, that's 424-465-3800.
And if you want to access me, you can find me at my website, very simple, psychologicalhealingcenter.com.
Perfect. Thank you so much. Ever wish you could redesign your look even just a little? Meet board-certified plastic surgeon Dr. Joshua Jacobson, the architect of beauty. His expertise transforms your vision into reality. Whether you're dreaming of a subtle enhancement or a dramatic change, Dr. Joshua Jacobson can meticulously blueprint your ideal self. Don't wait. Contact us today at 424-465-3800. That's 424-465-3800. On a lighter note, in a positive way, can plastic surgery improve the mental health of somebody with body dysmorphia, or can it just exacerbate the condition?
I think it'll probably exacerbate the condition.
Okay.
Because again, what they need is psychosurgery, not plastic surgery.
I like that terminology
Yes.
too. I'm going to be taking home a couple of these with me today.
I think we should do an episode on psychosurgery and where that can then lead to healthier plastic surgery.
I love
Yes.
that. I love that idea.
Augmentation
Yeah.
and self-esteem enhancement.
Yes. Now, can you give me an example of someone who doesn't have body dysmorphic disorder, but they have actual concerns and they're legitimate, and surgery would actually make them happy?
Sure, I think somebody who has had numerous children and their stomach is hanging and there's excess skin there, maybe their breasts are just annoying to them, they don't even fit into a bra anymore, there's distortion, maybe back pain because they're too heavy. I think they can say, I deserve to have my youthful body that fits me. And again, I think if it's restorative, then you're not in the zone of body dysmorphic. I just want to be my old self.
Yes, that is a great example, and I really like that. And that's one of the things that I screen through with patients, whether they're trying to get their old self back, or they're trying to look more normal, or is it just something out of this world?
Yes.
What signs and symptoms, Dr. Judy, would help me be able to see if a patient has the body dysmorphia or not?
Well, you could just look at them.
Okay.
Okay.
Just
and you could just look at them, and you've got a good instinct. So just use your instinct. And if they're speaking in I messages, and they're picking at themselves and poking at themselves, and if they're just over the top, that might be a sign. If they look like they've had plenty of plastic surgery, then you might be wondering, why do they need more? Okay?
Yeah, great. Are you ready to achieve the body you've always dreamed of? Look no further than board-certified plastic surgeon Dr. Joshua Jacobson. Dr. Joshua Jacobson offers a range of surgical procedures to help you look and feel your best. From breast augmentation to tummy tucks, our skilled team will work with you to create a personalized treatment plan designed to meet your individual needs and goals. Let us help you achieve the confidence and beauty you deserve. Don't wait. Contact us today at 424-465-3800. That's 424-465-3800.
Dr. Rosenberg, I have a question. Let's say someone does have body dysmorphic disorder and they seek help from a mental health professional. Is there light at the end of the tunnel? Would they be able to get healed?
I'll give you two answers. Number one, they may not want to come see me because they might want to use that money for another plastic surgery.
Which I will not accept.
Okay. Number two, if let's say something went seriously wrong.
Yes.
And somebody said, hey, sorry, you're now damaging your health. You better go see a shrink for this one. Then if we can go back into, I call it the causal area, where they can now deconstruct the childhood wounds, then they're going to have to go through the process of grief and anger and disappointment.
But if they're willing to put,
they heal, yes, then they
if they're
can.
willing to put the work, they can heal. That's good. That's good to hear.
Yes.
So we'll be sure to refer them to you in case we have patients that are struggling with that.
And sometimes people have to bottom out
Unfortunately,
before
yes.
they go to therapy. Like an alcoholic, they have to bottom out before they stop drinking.
Unfortunately, yes, that's true. And what's unfortunate is I've seen time and again where patients have gotten surgeries and then they don't realize that this is the problem, and they come to us and they have had 3 different plastic surgeons in the past doing different surgeries on them, and they are bitter at each one of them. And a lot of times I know the plastic surgeon, I know they're a good surgeon, I know that's not true, and then they think I'm going to be able to fix them, I'm going to be that hero, and they come in saying, well, you're the best, you're going to do this, you're going to do that. And I know it can be tempting for plastic surgeons to say, well, yes, I'm the greatest and I can fix everything other people couldn't fix, but I think that's a big trap.
Because the expectations are unrealistic.
Yes,
Right?
and in training, in plastic surgery training, they do tell us, they emphasize a lot that patient expectation is everything. So make sure you set the right expectations.
And that's a good question that you can ask the patients, the potential patients. What are your expectations? Draw me a picture. I'm going to show you some pictures now. Do you expect your nose to look like this, like this? How far do you think the doctor can lift your breast without injuring your body?
Okay.
So these are some pertinent questions you can ask.
Thank you so much.
And actually, as you've seen me ask patients, well, you want a breast augmentation, show me some pictures of things that you like. It could be from magazines, it could be from other plastic surgeons, any website. And you've seen me tell them either, yes, that's very possible, or sometimes I tell them, that's not possible with your body. Sorry, I can't deliver that. And they need to know that. And sometimes that actually sets their expectation. They'll say, well, okay, I understand that you can't get that. What can I expect to accomplish?
Right, and some patients are not happy with that. Think about the patient that we had with the husband and the butt.
Yes.
Right, and we gave her and her husband a recommendation for a great doctor right around the corner from us that could do the work, and they still wanted you. But they're set on a doctor. Even when the doctor says, "Hey, I can't do this," people have their head set on that particular doctor. But we won't operate on somebody if we know that they're not going to get what the desired look.
I just wanted to add something to the discussion, which is the narcissistic part, which is really an injury to the self. So if they're now projecting on you that you're not good enough, that's because they're feeling not good enough. And if they come to see me, they're going to project on me that I'm not good enough.
Yes.
And so I have to work with that. That's the material that I need to work with within the therapeutic process.
And that's probably what's happening, how they're feeling about their previous plastic surgeons. They say they weren't good enough, even though a lot of them may have been.
That's right.
Are you ready to achieve the body you've always dreamed of? Look no further than board-certified plastic surgeon Dr. Joshua Jacobson. Dr. Joshua Jacobson offers a range of surgical procedures to help you look and feel your best. From breast augmentation to tummy tucks, our skilled team will work with you to create a personalized treatment plan designed to meet your individual needs and goals. Let us help you achieve the confidence and beauty you deserve. Don't wait. Contact us today at 424-465-3800. That's 424-465-3800.
Well, the time has flown by again, and we barely scratched the surface. Dr. Judy Rosenberg, you've been really helpful, but I feel like there's a lot more to talk about. There's a lot more that we can learn from you. Would you be willing to come on another episode of us?
Of course, it would be my honor.
That would be great. All right, so you guys, make sure you tune in for our next episode talking about body dysmorphic disorder and body image with Dr. Judy Rosenberg. Well, it's been a pleasure to have you so far, and we're going to have you again. I also want to thank our listeners for tuning into the Beauty Blueprint. I hope you've all enjoyed the discussion, and you're going to tune back in for our second session. Make sure you tune in every Sunday at 7:30 a.m. on Go Country 105 FM to listen and learn everything you need to know about plastic surgery. Whether you've had it done or you're considering having a procedure in the future, we have many more exciting topics that we're going to be covering on the air, including more of this body dysmorphic disorder topic next week. As always, if you have any questions or if you want to book a consultation, give us a call at 424-465-3800. That's 424-465-3800. Also, make sure to follow us on Instagram at Josh Jacobson MD. See you next time, same same place. I'm Dr. Joshua Jacobson, your beauty architect.